I'm Tal Blair, creator of Motion Guidance, and I'd like to share with you the background on our visual feedback product. Motion Guidance is a rehab tool that can be used on any patient, on any body part, to add a visual feedback external cue to their rehab program. So whether you're trying to maximize a patient's ability to control their movement throughout their full range, work on neuromuscular control through specific ranges, or simply trying to promote movement awareness, the Motion Guidance adds an external cue that's intuitive to patients, and they can see the outcome of their movement without trying to cognitively process how they are supposed to move or how they think they should move. The application of Motion Guidance is limited only by the creativity of the therapist. So for instance, you could work on cervical neuromuscular control after a whiplash injury, or shoulder positional awareness with an overhead throwing athlete. Another common use is dynamic lower extremity control, for instance with a soccer player, assessing their dynamic valgus, teaching them to control into their dynamic valgus, or simply work on controlling all their available movement patterns that they have. There's been research supporting external cues as opposed to internal cues for motor learning, as well as evidence that post-injury patients have a positional awareness deficit. So their recognition of where they are in space has been altered, whether that's from pain or the other things that are associated with injury. Motion Guidance can act as an assessment, a reassessment, and a training tool. So I'd like to go over kind of the basics of our product. The clinician kit consists of 2 straps. One of them is a large strap that could be used around your head or your trunk. The other strap is a smaller strap that could be used around your knee or wrapped around your shoulder. One of the unique features of the Motion Guidance tool is that it features a ball and socket joint and a laser pointer that can be adjusted to point in any direction, and once it's applied to a patient, you can adjust it yourself without having to move a strap around to find that neutral that you're looking for. So for instance, you can pop on to one of these 2 mounts. There's a perpendicular mount and a parallel mount. And that simply slides into a pocket on the strap. And again, you can apply the strap to basically any body part. The Motion Guidance Clinician Kit also includes a tracking grid that you can simply hang on a mirror or glass with suction hooks to work on the cervical or shoulder applications, or you can drape it on the floor to work on lower extremity movement assessments. I find the Motion Guidance system a simple and effective way to add a new and novel external cue to your patient's body awareness and movement strategies. Beyond being another therapy exercise rehab product, the Motion Guidance allows your patient to assess their quality of motion, their control of motion in a way that's intuitive and fun, and they'll view it more as a game, especially with adolescents. Soccer players, they're more likely to adhere to an exercise program that to them is stimulating. It changes kind of the context of it. So feel free to navigate around our website, check out some of the videos we have under the Clinical Application tab, and email us with any questions or comments. Thank you.